Living within UK communities are nearly 600,000 illegal immigrants. Men, women and children without the documents they need to make a home here legitimately. But a report is to reveal that many are failing to seek medical help, even when they're ill, over fears that visiting a doctor will make them known to the authorities they've been trying to avoid. Richard came here from Uganda in 2003 and is still seeking asylum. He understands that anxiety.
You get frightened, so what happens is that you decide to hide away, and then if you have any medical condition, any problem, you end up getting worse and worse, and in the end you may even die because you don't have any help.
The research by the think tank Demos shows that the vast majority of undocumented migrants are not registered with a doctor, with a fifth saying they're too fearful to come forward. Others have been wrongly turned away from GP surgeries.
And when we think about global crises like Ebola, what we need to make sure that we do is find people who are unwell and make sure that we're isolating them, make sure that we're treating them. We can't do that if they wait until they're incredibly ill before going to seek healthcare, because that means that it's already too late to prevent the infection from spreading.
A solution has been suggested.
How are you feeling today? Are you feeling well, or do you need to see a doctor here in the clinic?
All-in-one centres similar to this one run by Doctors of the World, where unregistered people can see a GP and seek advice, no questions asked. The argument is early detection of health problems will reduce the cost of delayed treatment, while also preventing transmittable diseases being passed on to the wider public. It's just a matter of convincing people it's safe to come forward. One idea to convince them is to allow health professionals to access information from the Home Office without permitting data to flow the other way. Dr Claire Shortall welcomes any move to ensure those in need get help.
Regardless of your position on immigration, I think that we're talking about vulnerable people like victims of trafficking, children, victims of domestic violence and pregnant women. We're talking about them not being able to access healthcare. I think this is a different question, and I think that any barrier that stops healthcare professionals from doing their job looking after these vulnerable people are essentially a bad thing.
Making sure illegal migrants can seek the help they need will not be popular with everyone, but it will make it easier for the NHS to keep track of the spread of disease. Emma Birchley, Sky News, East London.